Hello, my name is Dr. Monica Flores. I'm a pediatrician in South Florida since 2001. COVID vaccine for teens and children. To vaccinate or not to vaccinate? That is the question. Deciding whether or not to sign your child up for the COVID vaccine is a process. This is how I, as a pediatrician and mother, approach the decision-making process. First, I believe in vaccines. I have seen their benefits firsthand. In my 20-plus years as a pediatrician, I have never seen polio or Haemophilus influenza, sepsis, or meningitis, in which children would become infected with a flu-like illness, later lose either their life or suffer severe developmental delay. I can count on one hand the number of cases of chickenpox that I have actually seen, and I personally experienced the benefit of vaccine against rotavirus, which would dehydrate children within 24 to 48 hours, causing hospitalizations and worry. I also believe in the system. I personally experienced the FDA pulling a vaccine during my residency because an unforeseen potential side effect was detected months after the vaccine had rolled out. I am in awe of the technology that went behind the development of the COVID vaccine. That being said, I tend to be cautious with new vaccines. I usually offer them to my patients, make them available, but personally do not recommend them until they have been out at least a year or two in the general public. But COVID changed all that. Everything about COVID is new, and whether or not we realize that we are still living in a bubble. Our children are not in school at 100% capacity. There are many less children in daycare, less parties, less exposures, less likelihood of infection. When we go back to 100% normal, things may change. I am more likely to believe in the safety of the vaccine just because the number of adults who opted in for the vaccine has been very large. The likelihood of an unforeseen side effect is low. The major drawback that I see to the COVID vaccine is a lack of knowledge on how long it will last and whether or not it will protect us in the future if the virus mutates. This likelihood of severe infection in children is remote, and children are less likely to be super spreaders, at least in the current environment. To decide if you should vaccinate your teen or eventually child, you need to take into consideration their health, the health of those around them, parents, grandparents, siblings, and close family. Will they be attending a summer camp or summer college program, or will they be residing in a dormitory soon? Will you be traveling by plane this summer, going on a cruise? Are they personally diligent about wearing their masks in group situations and washing their hands in order to decrease the risk of infection and likelihood of bringing the infection home to you and your family? What is the likelihood that they will be forced back into the classroom, either because of a drop in grades, an increase in weight, or depression from being home? What is the likelihood that your state will continue to mandate masks until we have achieved herd immunity? For all those reasons, the decision to apply a COVID vaccine to your teen or child is a personal decision. Take the time to weigh all the pros and cons. Call your provider if you have any questions. Discuss your personal situation with them and get their opinion.